and committee. 2, develop a policy agenda and make a recommendation as it relates to reentry programs, services, and populations. 3rd, assist CAB with developing an annual budget request. 4th, analyze and make recommendations to improve departmental budget development, reporting, and analysis. 5, identify financial needs for training and consultation for the CAB. 6, other responsibilities and functions that advance the committee's and the CAB's purpose. We are grateful for those who are members of this committee, and we appreciate your time and commitment. Now, as our fearless leader would say, let's get to work.
Okay, Ozzy, would you like me to do roll call?
Yes, please.
Okay, Ozzy Carter,
Here.
Lila Blanchard,
Here.
and Dr. Terrence Cole.
Here.
All CAB members present.
Thank you, Monique. And our staff that's present.
So yeah, we'll go ahead and do introductions. Patrice Guillory.
Hi, good morning, everybody. Patrice Guillory here from ORJ. Good to see you.
And I am Monique Tate from ORJ as well. Thank you.
And thank you, Monique.
And then we have a few more people in attendance. Vice Chair Ozzy. Crawford Carpenter, would you like to introduce yourself?
Good morning, Crawford Carpenter, a CAB member.
Thank you. So those are all of the introductions, Ozzy.
Thank you, Monique. And next, our announcements. Are there any announcements?
This is Lila, and I'll pop in information into the chat regarding our hybrid celebration of folks who are completing our workshops at Rubicon programs, which is not happening this Friday, but next Friday from 9 to 10 a.m. So I'll put that information and my email address for more questions into the chat.
Thank you, Lila. Any other announcements? Moving on, we don't have any public, but we have a line item, public comment on any item under the jurisdiction of the Community Advisory Board and not on this agenda. Hearing none, we'll move on to the approval of the minutes from our previous board meeting. That's in your packet. Thank you, Monique, for finding that so that I can get the correct date, which was Friday, May 27. Do I have any motions for approval of these minutes from our last Policy and Budget Committee Subcommittee meeting?
This is Lila, and I'd like to make a motion to approve those minutes.
And Ozzy, I second that motion. Terrence.
Thank you, Lila, for the motion, and thank you, Dr. Cole, for seconding that motion. And now for a vote.
Would you like me to do the roll call?
Yes, please, Monique.
Okay, Ozzy Carter,
Aye.
Lila Blanchard,
Aye.
and Dr. Terrence Cole.
Aye.
Motion passes unanimously.
Thank you for that, Monique. The next item on the agenda is the CAB policy brief and budget proposal planning. And Monique, could you please go to, according to our agenda, we would need to look at the PPC meeting agenda, item 6, approving the fiscal year 2022-2023 AP 109 budget proposal as recommended by the CCP Executive Committee. First, we'll take a look at attachment A. And primarily, we're getting a look at that budget as presented by Paul Reyes at that meeting. And the floor is open for any questions, concerns, and discussion. So I'm going to ask for a little help here just to get a little more clarity and a better explanation of what we're actually looking at. And I would like someone to kind of give some insight on what we're actually looking at and what the responsibility is for the Policy and Budget Subcommittee in viewing this expenditure report.
Sure, I'll jump in here. So just as a recap from you guys' last meeting, which was also described in the minutes or the record of action, last time we went through and discussed the AB 109 budgeting process here within the county. And after that sort of walkthrough, we also talked about then in preparation for developing a policy brief for this upcoming fiscal year, as well as budget recommendations, you all wanted to look at the prior the prior year's recommendations, as well as you guys' policy brief, to start dialoguing about that, kind of getting a sense of where expenditures or where is funding allocated now, and just discussing that through if there was any need for more funding someplace or other questions you may have had. This would be your opportunity to kind of dissect the information and talk that part through. There's also on this agenda, so what we're looking at were attachments to the PPC agenda that was done on February 28th, which approved the CCP's budget and is now part of the county's budget plan for the next fiscal year 22-23, as well as you guys' policy brief. It was included in that as well. The second attachment that's on your agenda, and you don't have to go to it yet, Monique, but the second one is actually the financial reporting of the fourth quarter of this current fiscal year, which is 21-22. That was presented at the last CCP meeting, which was on June 3rd. Many of you were in attendance for that one. So again, this is just some reference docs for you to read over, to think through, to discuss as you are thinking about what you would like to do in terms of any policy recommendations for the next fiscal year, as well as any budget recommendations you'd like to make for the next fiscal year.
Thank you.
And what you have in front of you on the screen now are the, actually, Monique, can you scroll up to the top of this? Yeah, up, there you go. So as it's titled, yep, as it's titled, this is for FY 22-23, the total request summary that was approved by the CCP and has also been approved by the Board of Supervisors. This gives you a breakdown of per agency, both county and CBOs, or at least the community programs, doesn't give the direct CBO, but the county agencies and the community programs. In this first column, which is 21-22, this was the total expenditures from the prior fiscal year, and then, or this current fiscal year, excuse me. And then the budget request, which is in the next three columns for 22-23. And so these are the dollar amounts that all the agencies will be operating from for this next fiscal year. You all are getting ready to prepare for 23-24. So to give you even more confusion, that's what your budget requests and your policy briefs will be aiming toward for that next fiscal year.
Thank you, Patrice.
Mhm.
Hey, Ozzy, I have a question for
Yes.
Patrice.
Okay, Dr. Cole.
In a lot of these line items, just wanted to ask about the salary increase in benefits. Is that because of COLA, or what's being implemented within the salary increase versus the other items?
Yeah, typically it is COLA. And for the community programs, if you guys can recall, you all recommended a 3% COLA increase for the next 3 years for the community program, so that they can apply that wherever they feel necessary because they're in contract. But the county agencies as well typically request a COLA increase somewhere around the same ballpark of 3%. And so that's was typically applied, or has been applied in prior years. And then Jill is here, she has her hand.
Hi, sorry, I was late. I was in another meeting. Yeah, so those salary increases are reflected from the union negotiations. So whatever that union negotiated as their increase is reflected. And then I don't know, Patrice, it was prior to the pandemic, I think that that the CAO's office agreed that the CBO should get that whatever average percentage of COLA, as well as whatever the county departments were getting.
I can
Going
double check
forward.
on that one, but I wouldn't be surprised if that was the case.
Yeah, they did. It was when Tim Ewell was still staffing, and
Okay.
he recommended that they do that to match what the county was getting, because the CBOs, the CAB had recommended COLA increases for those CBOs.
And Jill, thanks for that. How often does the union negotiate these salaries? Is it every 3 years, 5 years?
It depends on the union. You know, we have a variety of unions. So there's a settlement on Tuesday's board agenda with several of our unions, the nurses and several others. So they're not on the same cycle, and some of the negotiations take longer than others. I mean, some of them, like the PDOCs, the psychiatrists, took several years to get a settlement. So it just depends on the union.
Got it. And it could be in increments over a period of 3 to 5 years, percentages increase, correct?
In the past, yes. Now it's more standard. There's not as much changes. It's somewhere usually around 3%.
Got it.
And so the only differences you might see is if there's a salary assessment done, which is done across different classifications. And so you might see an increase more if there's been a a salary survey done to bring salaries up to, sort of median salaries for the area.
Got it. Okay. Thanks, Jim.
Should
And
I go
thanks,
to the,
Patrice. Sorry.
should I go to the next item on this item, Ozzy?
Yes, please.
Okay, just one sec.
The next item we'll be looking at is attachment B. Which I believe is a policy budget brief.
Attachment C, and I
Is that
will share
C or B?
C, and I'll share my screen in just a second. Okay. Can you see the memorandum? Or hold on.
Yes, we can see it.
Okay, hold on one second. Let me go back to the agenda, page 8. Okay, here it is. Sorry.
So this was the quarterly financial summary that was presented during the last CCP meeting. Is this what you guys, is this what you wanted to look at next, Ozzy, or the policy brief that was just up?
I was under the impression we were supposed to be looking at the policy brief. I could be very wrong,
Okay.
but
We can-
I need
Yes, you're Madam Chair, so we will look at whatever it is you're calling for us to look at, okay? It's all good.
So I'm going to need some help with this. Monique, what were we looking at this memorandum?
So on this, the policy memorandum, we were looking through the items for the CAB members to review and basically look at each recommendation. And these could possibly be an agenda item on a future meeting. So that was the guidance.
Thank you for that.
You're welcome.
So just kind of to get some clarity and to take some pressure off, I wanted to ask specifically for something that I'm kind of wanting to see. And it's going to be something dealt with on another committee, Program and Services, which I think would fall under possibly number 3, which would be implicit bias training and what that would look like. And we're moving forward on that on the next month's Program and Services Committee meeting to see how it's going to be agendaized and moved forward. But just to kind of break the ice, because I'm really still in the learning mode and understanding that when there's something that one of the board members would like to see and that reflects some of the policies that we are as a collective subcommittee are working toward the goal, and any suggestions would be beneficial, and any types of comments also, if there are any other ideas, any other things that you would like to see collectively. The floor is open for discussion at this time.
Ozzy, it was great to have you come to Programs and Services and to talk about the training. I am understanding that we are going to be updating the CCP on some of these recommendations, and I'm wondering if recommendation 3 is one of those recommendations. And I love that this is a real, step and idea for bringing, some tangibles to recommendation number 3.
Thank you, Lila. Dr. Cole.
Yeah, thanks, Ozzy. I concur with Lila. And also, if we could add, if these recommendations, how do they compare to prior, and what's, are they ongoing? Where are we in that kind of phase where we're seeing this, or this is just in concept, course, in practice? Where are we in regards to some of these being embedded within policy? Just a thought as we begin to put items on the table to consider. So yes, I do agree with what you're considering and recommending, Ozzy. But I would be interested in knowing where we are in regards to some of these policies being housed in a certain place, and also the prior ones, and how much leverage did they make into the consideration of these recommendations to see where we are. Thanks.
And Jill Ray has her hand up, Ozzy.
Jill, go ahead, please. Thank you. Thank you, Dr. Cole.
So Patrice, when you were with the network, you guys did a series of trainings along these lines, I recall. Maybe you could talk a little bit about that, because I think and I don't know what the network's doing now, if anything, or Reentry Center along these lines, but I mean, those were some phenomenal trainings.
Yeah, so we did trainings around motivational interviewing. We did some trauma-informed care training within behavioral health settings. We did, it was a pretty popular one. I'm so mad I'm forgetting the name of it. Anywho, it really spoke to the trauma that one experiences in being in the nature of being incarcerated, right? Like there's trauma that could be experienced prior to your involvement with the justice system, but specifically with being incarcerated, what that experience is like. And so what is then carried with that individual when they are coming out and then seeking resources. I'm so mad at myself and I don't remember the name. Anyway, it was a really, really popular training that we had. We also partnered with the county's, the Contra Costa Crisis Center to do some work around grieving and supporting individuals who are experiencing grief. And this was really at the beginning of the pandemic. We ended up just shifting over to virtual trainings. So there were a whole host of things in regards to just different areas that we know that providers would be faced with when supporting clients. We also partnered with Community Works West, and we did some restorative justice one-on-one trainings. Yeah, it was a ton of different stuff. But I will say, at least here at ORJ, with our planning and implementation funds, we are starting to look at maybe for the next year or two, potentially identifying some training opportunities or opportunities to train cross-system. This would include CBO partners as well as county agencies, simply because we are really focused on promoting the application of evidence-based practices. And so we want to make sure that folks are adequately trained. And if they have been trained, but it's been eons since they've been trained again, we want to make that opportunity available to as many folks as possible. So I will say internally, I am definitely looking at that to support, you know, ensuring folks are adequately trained in evidence-based practices for sure.
Thank you, Patrice.
I see Terrence's hand. Oh, did it just go away?
No, you're thanks, Layla. Thanks. Ozzy, if I can just jump in real quick. Patrice,
Absolutely.
thanks for that, Patrice. And I just would like to ask, and I know that probably those trainings were probably fabulous. And I just want to ask, during the process, was it inclusive to the participants as well? The trainings, could they participate in some of these trainings, or did some of that take place during that time?
Yeah, thank you, Jill. Post-prison shock. Thank you. I'm so mad I couldn't remember that because that was our favorite training. And some general responsive training as well. And some case management training. We did some training on approaches to case management. Anyway, bringing back all kinds of memories, good stuff. I'm sorry, Dr. Cole, your question was this available to participants themselves? No, these were primarily for frontline staff and program administrators who were delivering these sort of services. We were really trying to support, you know, enhancing knowledge as well as skill development in some of these areas, and a reorientation of what it's like to support someone that, or to at least better understand the complexity of circumstances and experiences of someone who is justice system involved. So, and at the time, you know, a lot of the providers, maybe with the exception of Rubicon, but a lot of the providers were organizations that typically served broadly vulnerable populations, right? But they may not have necessarily had a lot of experience in what it's like to serve someone that would be on probation or parole, and what those other elements bring to the table when you have to service that person, right? If someone is rearrested while they're receiving service, does that mean you completely disrupt the service and disconnect them? Or do you hold a slack for this? So for some providers, those sort of nuances are really imperative to be aware of, and kind of have to shape your service delivery around that, and to anticipate that you're going to have some ebbs and flows. Is not just straightforward, right? You're going to have some ebbs and flows when you're serving this type of population. So the goal was to really get, like I said, frontline staff and program administrators sort of up to speed and have a different sort of orientation when you're talking about servicing the reentry population, which is very different from other populations. Challenges are still the same, but how you go about your approach and how you deliver the service is somewhat different. But I will say we do encourage, obviously, in a lot of the community programs within their budgets, they have line items dedicated for workshops and things of that nature to help build up the skill development and knowledge base of the participants themselves. I'm sure Lila can speak to some of the experiences that they have in terms of trainings that they provide to those individuals, whether it's around employment, whether it's around parenting classes. If there are, I know the network still hosts their Reentry, the Bigger Picture workshop series, which allows for individuals to come in, participants to come in to talk about their experiences, and then what to be mindful of in their reintegration process. Because reentry is a process, it's not a one and done, right? So they touch on some aspects of that to support life skill development and just personal development, and any sort of professional growth that they are looking to achieve.
Thanks, Patrice. And that's kind of the navigation system I was looking at in reference to the
Yeah.
participants in, moving forward, kind of changing, developing, and just, looking at another scope of life through a different lens. How do they get there? Even though we have the staff to work with them, right? But yet, the participants, in regards to changing, what life looks like in the future, they need to have a scope of, like you said, the mindfulness, seeking safety. How do they do these different things? Trauma-informed care. What is that? And they may be living that. They may not know. So these things are very pertinent for that population, as well as the staff. So totally understand, and you hit it right on the head. So thanks for that. Thanks for the information.
Sure.
This is Lila, and I'll just jump in there if that's okay. So I will just, speak from my experience at Rubicon programs. In our workshop, we have a workshop that's structural causes of poverty. We also have a workshop that is relationship-based. And so, as we, move forward with different trainings, there may be things that are already being offered up in with different county departments or CBOs that can provide options for others. And, we can also, look at different ways that we can share, some of these important concepts with our participants through, direct services as well. So great point on that, Dr. Cole, and thanks for bearing with me while I got around to the end of my point. And then Dr. Cole, earlier on, you were talking about these recommendations and if they get carried forward. I'm not sure if we addressed that yet. This is the document that we will be doing whatever we want with this year and then resubmitting. It seems like in prior years, there's been this method of taking what's there and updating it. I don't know when the last time was that it was really like a totally new set, maybe three years ago, but I just wanted to add that. And I'm really glad that we're taking a look at these recommendations and reviewing them. And it would be wonderful, to have this on the agenda for next meeting as well. In case there's anything else that we, want to spend time on reviewing or discussing all of the recommendations.
And I just want to call out what Jill put in the chat from the 2021 CCP agenda packet in June, which includes your recommendations from that year and staff's response to them. So I think it's a good point that Dr. Cole is raising, that as we're looking at this prior year's policy brief and recommendation, you can do so in conjunction with the ones from the year before, where staff made some comments about next steps, and kind of pick apart at the very least what you would like to see be discussed at future CCP meetings.
I guess I'm gonna jump in there and raise my regular hand again. I was curious if we could talk Ozzy, if you're ready to move on from this, I was curious if we could talk a little bit about the up-to-date reports that we got, and I hope that I'm not getting confused with another agenda, but the the actuals of what folks have spent so far, if we could, you know, review those together and just get a snapshot at how the ones that were submitted in this report are looking. And I'm just double checking and making sure that I am talking about this agenda. We're on the wrong agenda. Okay. Yeah, so we got a number of reimbursement request updates. And so, yeah, if anybody from ORJ has digested those at all, I did a quick review of those. I think that was pages, let's see, when did the pages start of all of those? It looks like attachment B, page 10, is that where they started? I guess my question would be if there are any standouts, you know, since ORJ, you know, received these and manages these, were there any things that stood out to you all in receiving these, or anything that you want to call our attention to?
You're asking in regards to the community programs?
Well, it seems like we got some of them from community programs and then some of them from county departments or the sheriff's office. Yeah.
Yeah, so can you guys see the screen that says AB 109 reimbursement tracking?
Yes.
Okay, so so Paul Reyes from CAO's office went over this at the CCP meeting on June 3rd, and the highlighted variance rates here kind of fall within that new policy that was adopted per CAB's recommendation, that if any, if the spending levels were anywhere either above or below, was it 15% or 25%, somewhere around there, that would be a call for that agency or that department to speak to essentially what's going on there. So you have H3, where they were budgeted for 393,000, and to date across the 3 quarters, where am I? Across the 3 quarters, they're only at just a little bit over, have spent just a little bit over half. Now, mind you, this is up to 3 quarters, right? And usually we'll know what quarter 4 will look like once the year kind of closes out. So we're not yet at the end of the 4th quarter. The 4th quarter ends at June 30th, right? So just to keep in mind of that. But everyone else, those that are not highlighted, you see they're at this threshold of about 75%, you know, 60, 80, they're getting pretty close. Workforce Development Board is somewhat over quite a bit by the 3rd quarter. They're almost at 90%. So you, without really knowing what is happening here, you can anticipate that they'll either overspend by fourth quarter, or their reimbursement requests would show a significant overage, or maybe not. We don't know. But that's why they were highlighted. ORJ, we were at 57%, and I'll go to our breakdown in just a minute. The Police Chiefs Association, they were at 21%. Community programs were also around the same ballpark as ORJ, and I'll show that in a minute. And then Superior Court was around 53% as well. What you see in these markers for Superior Court, that there was no billing, or at least, no billing that was tracked, or our assumption is nothing was submitted in the first 2 quarters. So that may have had an impact on why they are at this level here of underspending. So same for police chiefs, and then for ORJ, though our expenditures have been roughly stable and the same. I'll go to it in just a minute, but to show you that we have a vacancy that we've held for some time now for a deputy director position in our staffing line, which contributes to that. And then our community programs, you can see in the first quarter, we had little billing, but then it increased over time, over the last 2 quarters. So we'll see this pick up quite a bit by the fourth quarter. Any questions on, at least this is just sort of a snapshot overview across all the agencies for the first 3 quarters of this fiscal year. Yeah, yes, Lila.
So the sweet spot for here would be 75% if you're looking at spending a quarter each quarter. And so it looks like folks who are maybe like 50% or below-ish, or you know, pretty far above 75% were highlighted for us.
Yes.
I guess the one thing that I'm curious about, and maybe we'll get to it later on, is health, housing, and homeless services. I mean, I don't know how much of this budget goes to, you know, housing folks, but I'm just surprised. Maybe this is about staffing, and just wondering if we know anything about, about that one.
Yeah, I will say, unfortunately, because this was sort of brought to everyone's attention at the CCP meeting, the agencies that probably should have been present to explain this, and then for those of us that were there, really didn't have much of an opportunity to get into the weeds of it as much. But in any case, I can scroll to the tracking for each of these agencies, where you can see the line items there, and we can take a look to see what may have been affecting theirs. I will say, though, that I do know that transitioning back to congregate living for their shelters have been affected, obviously, because of COVID. And for the AB 109 funding, a good chunk of that, the funding that they have, is reserved for that, for emergency shelter. So I wouldn't be surprised if that may have impacted their spending, so to speak. But they were pretty consistent for each year. I mean, each quarter. It went up a little bit by quarter 3. So we may see a significant uptick by the fourth quarter. And then Jill has her hand up.
Yeah, I was just going to say that H3 oftentimes doesn't fully utilize those funds because it's about shelter bed use. And so if those exiting or entering re-entry choose not to go to a shelter, then those beds are not utilized. So it would not be uncommon combined with the pandemic, but also there was a heck of a lot of funds available for the hotel beds and all of that. So I'm not sure how that impacts the whole fabric of the funding. And then some of those departments like Workforce Development Board front load. And so they don't have, funding needs at the end because everything's front loaded.
Mhm.
I'm gonna make this just a little smaller so I can fit all of it on here. I'm sorry if it's too small. Oops, that's smaller. Hold on. Okay. A little better. So this is H3's budget, their AB 109 budget. So you see it broken down by staff and benefits, and then some of their operational costs here. And this is staff. So you have your case managers that are staffed at the different shelters, the program supervisor for each of the shelters, their evaluator administration to handle all of those needs. For the actual operating costs, and this is to Jill's point, the bed costs for Brookside was shut down for a period of time, I believe. So, or at the very least,
It was shut
bed-
down because they utilized the hotels. And so they had
Right.
staff at the hotels, not at the shelters.
So this meant that there were no beds charged to this at Brookside that were charged to this budget. So that's where you're seeing sort of no expenses being made here. And at the same time, no number of bed days. For Concord, it's a little different. Concord did open back up. So you are seeing that beds were charged to this contract, to this budget, and for the number of days per quarter. Or, yeah, the end of each month. Oh, this is a monthly breakdown. You also have a breakdown of costs per shelter that can give you a good sense there of the distribution. So that's essentially what contributed to where they are at in terms of their expenses. Now I can go to ORJ and community programs next, if that's what folks like to see as well.
Sounds good.
Oh, Lila has her hand up. Yeah.
I'm just thinking, about how many folks are desperate for housing, and like if this money doesn't get used, does it just go back into the general pool? Do we know if it's going to be used? And maybe we have, I know that there's a lot of people working on this, but suggestions specifically about how to get funds into folks, hands who need housing desperately. I know that there are hotel vouchers and other things like that. So it's a big idea. I'm just throwing it out there.
Yeah, and so to your initial question, which we talked about last time, and Jill thankfully corrected me on this, any unspent AB 109 funds goes back into their reserves. So so money is there. I would just mention that for H3, this is one aspect of housing for the reentry population that is available, right? This is just for emergency shelters. So that's what this budget is representing. Now, we have the housing programs that are through the community programs. You technically have housing available, so to speak, through behavioral health or ALDS when folks are going through residential treatments. And I do know that they have the connections to recovery homes where folks can then do a step down sort of process and receive housing through that pathway. Obviously, H3, beyond just this AB 109 budget here for emergency shelter, they have a whole host of state funds that are all dedicated to supporting coordinated entry with the core teams that do their needs assessment, intakes of individuals, and identify the appropriate housing programs and options that are then available to them. But so far, at least through the AB 109 budget, right? That's only one budget, only one pot of resources in the county on this. Not the only one, but one of many that are focused on that is focused on reentry. You have H3 and then our community programs, and to some degree, behavioral health all have some housing aspects to it. So, and what CAB has done, what you guys have done, you guys have talked about housing a lot, right? And you've even through programs and services, you all wanted to see, well, what other housing resources are out there and available beyond what AB 109 is able to produce. And so we heard some of that from H3, and we're hearing about, this Measure X funds. We're going to soon hear from behavioral health about beyond, again, AB 109, what other resources are they receiving to provide housing. Mind you, it may not be necessarily dedicated to individuals who are justice system involved, but certainly for vulnerable populations who are consumers of the behavioral health system, right? So there's a lot to tease out, and there are, unfortunately, we're not at the place to keep pace with the need, but the money is starting to flow. Who would have thought? Money is starting to flow. And that it just kind of takes time to ramp things up. So just wanted to add that as part of the context here.
Thank you, Patrice. I see Jill, you have your hand up.
Yeah, I was just going to say, before this meeting, I was in the health plan joint conference committee meeting, and a large part of the discussion was CalAIM and the need for housing for this population of people, and how they can tie in together funds for housing as well for these individuals who need to be wrapped in services, and some of those are transitioning from jail. So it's a conversation, I think, that's happening in many different areas, not just H3, but also in our health plan and our health system. And it's a larger discussion for sure.
Thank you for that, Jill. Are there any other questions, concerns, or comments? Hearing none, move to item 5 on the agenda. Okay, that is accepting updates from subcommittee members on work plan assignments. And that's attachment 3. So our goal 1, continue advocating for and tracking progress toward equity in the criminal justice system in Contra Costa County. And the key action steps is to review research and data findings on where inequities may exist in the criminal justice system for specific demographics such as race, ethnicity, gender identity, ability, mental health status, and et cetera, and its impact on AB 109 implementation. And the timeline is ongoing. And Dr. Cole is responsible for that. Would you like to take it from here, Dr. Cole?
Thank you, Ozzy. Yes, thank you. Yes, I'm still, this is one of those that you pull reports and you review, you bring back. I'm still working on this. And I want to have a set kind of strategy at looking at this process because I want to see where, I think there was a shift in things during the COVID, but I could be wrong. But I'm still reviewing some of these line items. So if I could bring something back to the next policy meeting that looks as if it's an outline, working on a strategy to begin to have a continuation of ongoing with this process, that would be ideal because I want to take a deeper dive into what's going on pre COVID, during COVID, and after. We're still in COVID now, but I'm just saying doing the kind of mile down in this process to bring something back to report. Thanks. Back to you, Ozzy.
Thank you, Dr. Cole, for that report. The next line item, key action step, is to identify gaps in Contra Costa County's criminal justice system to CAB to support policy statement or CAB stance on racial and gender justice issues. And Lila is accepted that responsibility. So Lila, do you have any reports today?
I'll just mention that this is, something that we are focusing on in programs and services, quite specifically. And so we're excited that the survey went out and that's been completed, and we got some initial responses in our last programs and services meeting. And so we will be getting a full report next month and definitely be looking to share that information with the broader CAB. And so, that's what I'll add is just where we're at on the timeline with surveys. No surprise. Mental health services were mentioned, as well as housing, were two big key takeaways from that, but we'll be sharing more soon.
Thank you, Lila. The third item is to assign a CAB member to attend racial justice oversight body meetings. And
So, Ozzy, Jill had her hand up. I'm not sure if it's still up.
No, she just left the meeting. She just was saying, you said Jill?
Yeah, Jill, she just left. Okay, thank you.
This third item under goal 1 is assigned to me. And it consists of actually attending the racial justice oversight body, the data, specifically the data subcommittee. And I've been attending those meetings, and I will be giving a report out at the next policy and budget committee meeting. But the committee meeting is next Thursday. So I will be giving the report out to the full CAB at our next meeting. And we'll also do a meeting report here at the next month's policy and budget subcommittee meeting. So moving on to goal 2, develop fiscal year 2022-2023 CAB policy and budget recommendations. And we've been doing some of that. Review CBO and community needs as highlighted in the Program and Services Subcommittee survey results, and align with AB 109 funding for community programs. And we have a timeline, July through October. And the expected outcome is to develop an informed budget based on community-based organization needs and community input. So from my understanding, we're waiting on the survey And from what my understanding is, the survey a summary will possibly be ready next month's Program and Services Committee meeting. Is there any other discussion?
Hey, Ozzy, I also want to add, I think that what we were talking about earlier in reference to prior recommendations that we see now, beginning to look at those and kind of dissect the information in which is held as content and what's in practice. Begin developing how, we can begin to identify what's happening in community versus, we continuously putting them, or standing behind the desk per se, given the orders. So just in light of that, beginning to understand the recommendation in a better aspect of how we move forward each year, and what's in the prior year we need to keep and what hadn't moved, and how we make that move within the scope of what we're trying to do within the recommendation. So I think with this section here, go to in what we was actually reviewing earlier with the recommendations, begin to look at those real finely and find out what is it that we need to do to make sure that the prior recommendations are happening before we begin to make new recommendations. So we making sure we're making steps. There's progress. What's the challenges and what's been improved? I just wanted to add that.
Thank you, Dr. Cole. And I would also like to add and thank my mentors who are really helping me to actually see and understand more competently what the budgets are, what it's looking like in the schematics, because definitely, I have to really be honest. I got on this committee because this is the only day that I had open. And I have no clue, but I'm learning so much, and I really want to thank everybody because I'm getting a bigger scope, a bigger picture, and the learning curve is still in play, but I'm moving fast. So I just want to thank everyone for bearing with me and filling in the blanks, because sometimes there's a big blank. So we're going to move to our next key action step, which is something that we did do today. We reviewed the quarterly financial reporting as presented during the CCP meeting to ensure funds are being expended as intended, and understanding and identifying the overages and underages and why, and getting a handle on that. And I know that's minor, but that's major for me to really kind of, get that cemented in, where if next year, if I have to be on the policy and budget committee, I'll have a broader perspective of what's really expected and what we're really actually doing. So the next item, and that's ongoing. The next item is proposed increasing funding for mental health services and propose more equitable access for reentry populations. Number 2, under that same key action step, propose bringing together CBOs and county agencies to identify culturally appropriate and accessible mental health resources. And the third line item under that same key action step is to consider the implications of CalAIM in providing more accessible mental health resources for the reentry populations. And that's ongoing, with the expected outcome of developing a holistic mental health strategy as part of CAB's policy and budget recommendations. And the floor is open for discussion. Lila, I see your hand.
Thank you. I don't know if Dr. Cole has anything that he wants to update on this. The thought that comes to my mind is, and I know that this process can be slow and laborious, is, understanding what is the mental health offering already of the system. So, for example, I know that in Rubicon programs, one of our core pillars is wellness. And so that includes physical, mental, wellness And so, yeah, we connect our participants to, mental health resources, and that's deeply embedded in our program, and it's one of our 4, core pillars. And so I know that we've talked in different spaces and places about, this was probably Programs and Services Subcommittee last year, about mapping what we're already doing, and that process got pretty bogged down. I just wonder, what types of mental health services and supports are happening. I know that we have talked about receiving presentations from, housing and different providers. I'm wondering if that's also an area in the CAB that we could start getting more information and presentations around, is, what's already being done, and what, I'll stop there. If folks presenting also have, specific areas where they could envision, more mental health services. So that was long, and I know, I guess I'll just try to summarize, curiosity around what we're already offering in the mental health space, and then potentially some presentations to the full CAB or to our subcommittee around those services.
Lila, thanks for that. I'm going to kind of echo off of what you're saying in regards to, what's happening around mental health. I think more so, and Carpenter always speak on this as well. I think more so of the mental health, substance abuse, and then we have the medical that's included sometimes. The dual diagnosis aspect of it has, it's always been there, but it's been more sought out to currently. I think the idea around the whole scope of this is, when the question comes about, and I don't know if Patrice or I think Jill jumped off, can answer this question, but how much of it is inclusive to dual diagnosis, and also included into shifting into Medicare, and these type of aspects of initiation in regards to these individuals that may be dealing with substance abuse for so long, also mental health, and then it's affecting their health medically, and how much of that applies financially to some of the programs. And I know that some of it's embedded in there, some of it may not be. I don't know what the full scope of how individuals are looking at this in the dual diagnosis aspect, but tying in the medical aspect is very important because of, high diabetes rate, high blood pressure rates, these different aspects that carries the same load as the longevity of usage of substance abuse and mental health. So just wanted to add that and put that on the table along with what Lila was saying. And if you can speak on that, that'll be good, Patrice. But if not, I know there's something that's on the horizon. A lot of different counties are looking at how to approach the dual diagnosis aspect of it. And some counties are connected, like the public health department is connected to their medical and how these things work in behavioral health. So I don't know in what role that Contra Costa is moving, but just to, put that on the table for discussion.
Yeah, no, those are excellent points. And I will say there's a couple of things that are happening. And then if you guys would like, I can go back to the quarterly report, and we can look at each of the health aspect or health related divisions that are doing work or are receiving AB 109 funds, so you can kind of see what their line items are. I won't give you the full scope of what of their approaches, but I'm a big believer that sometimes if you look at their budget, you can at least get a sense of how services are intended to be delivered, right? Because they're putting money to certain things. But I will say that ALDS as well, so that's our alcohol and other drugs services division, and forensics mental health are two units or two divisions under the behavioral health services, which is then in our county health department, right? And those two entities receive AB 109 funds. Forensics mental health actually has mental health clinicians that are dedicated to serving individuals that are on AB 109 probation. So they receive referrals directly from probation. I want to say also their general supervision too. Individuals that are, so generally speaking, individuals that are on probation that have been assessed by their probation officer in need of some mental health support would be then referred directly to those mental health clinicians at Forensics Mental Health. And then it's also the same case for individuals who are in need of substance use disorder treatment. They're also directly referred to AODS. I do know that internally between the two divisions, they try to work really hard to integrate that support because they are coming across clients, right, that have co-occurring disorders. So there is some work there where there may be a substance use disorder counselor and a mental health clinician together placed at a certain behavioral health clinic, or depending on what is the prevalent need, if it's you are self-medicating with substance to address the mental health concern, then the mental health clinician might be taking the lead versus the other way around. So they have a way internally for how they approach those situations. You also have detention health services, which has their own mental health wing that's very robust and has been very cognizant of and supportive of individuals while they're incarcerated that have mental health challenges, and ensuring that before they are released, they have 2 weeks worth of medication to hold them over until they can see their until they can make their first appointment at a local behavioral health clinic when they are released. And then AODS has just recently started providing drug treatment in West County, I want to say West County Detention Facility. And then they also have counselors that are sort of floating around to all of the jails. Lastly, within health services, there is a group called the Transitions Health Clinic, or Transitions Medical Clinic. I think I'm naming it right. And this is Transitions Medical Clinic is actually a model that has been adopted by health departments really across the country, which is to create a safe space for individuals who are formerly incarcerated to start addressing their more chronic physical health needs. So the hypertension, the diabetes, any sort of heart condition, things of that nature, right? Those preventative diseases or illnesses, but that happen to be chronic among this population. And what happens with this Transitions Medical Clinic is that there are physicians as well as I believe either clinical psychologists or a psychiatrist that are giving their time outside of typical clinic hours. So at like the Pittsburgh Health Center and the West County Health Center, and I forget, I think there's a third one somewhere. Anyway, out like after 5 kind of thing, we'll set up appointments so that these individuals who are participating in the Transitions Health Clinic can in fact see a regular physician and or it's either a psychologist or psychiatrist. I can't remember which it is that they have available. And they also, as part of that, have what they call health conductors. So these are the folks that are help the individual navigate our county's health system, because it is incredibly confusing, convoluted, and you can get lost, okay? We have a pretty large health department and with all the various divisions, and just trying to access the support that you need can be really, really tough to come by. So the health conductors help with that health department navigation, and also host what they called remedy groups. So these are workshops, groups that they have with these participants to go over all kind of stuff that is about improving health outcomes for the individual as it pertains to, you know, chronic health issues. So it is, and in that clinic, you won't see that here with regards to the AB 109 budget, because they're actually funded or have found support elsewhere and have been, I want to say, they've been in operation for several years, probably maybe right around the time AB 109 came down. So they were already doing that kind of work. And when we host our AB 109 partners and providers meetings, we include the health conductors as well. So they're part of the conversation. They're aware of the programs, the AB 109 funded programs. Those programs are aware of the health conductors and oftentimes connect with them to be able to do some cross referring. But let me know if you want me to go to the back to the quarterly report, the financial report, and we can look at each of those health divisions that are receiving AB 109 funds, just so you can get a snapshot of what's the staffing there and what are the operations that are being funded. Sorry for the long answer.
Thank you, Patrice. I saw Dr. Cole's hand up earlier. Dr. Cole?
I actually had a thumbs up for what Patrice was saying
Okay.
in regards to how this coordinates together and sometimes get convoluted and there's some gaps, you know, so sometimes it's hard to fill in the gaps when you don't know what you don't know, you know, so we have to be mindful of that as well. So, but Patrice, I thank you for, you know, sharing that information with us, because, you know, it's very important that we not miss out that element, the medical element to it, and have a navigation system of referrals to make sure that it coincides to totally, you know, kind of getting back to the whole person care type of idea, even though they don't exist no more. In moving towards what Cal AIM is trying to do in this next segment. So we want to make sure that we're all inclusive in how that works and how it works with the actual consumers that we're working with. You know, what does that look like? And also, Patrice, let me just add this piece. So preventive services, so how are you looking at preventive services with ORG? What are they looking at in regards to preventive services in regards to the same thought process that we just went through?
In terms of health prevention?
Yes.
Yeah. I'll be honest, I don't think that's being discussed probably enough. Now, when COVID happened, there was a huge outreach and push to connect with through health services department to be sure to educate those who are formerly incarcerated, those within the reentry population or justice system involved, you know, around vaccinations and just ultimately staying safe, right, during the pandemic. But I would say it's probably likely through remedy through those groups and with the health conductors that a lot of health prevention discussion is happening, at least with actual participants. But outside of that, I'm not quite sure how else it's being incorporated that I'm aware of. Now, I know Rubicon has a wellness aspect to their work. I don't know if some health prevention stuff is going on there. And then within the health department, there is a unit called, because there's so many units and divisions, there is a unit called Community Wellness and Prevention Programs. And typically they look at health prevention and also social determinants of health as an avenue to really support specific vulnerable populations. They haven't really looked at re-entry directly to my knowledge, but they're starting to look at things like gun violence, right? Or violence prevention as a health issue. And we do know that some of our population it can intersect with that. But that's all I can say at the moment from the top of my head. But you know, I'm sure there's more out there. I'm just not aware of it that's specific to reentry.
Thanks for that. Good to know. Ozzy?
Yes, thank you for that discussion.
Oh, Isaac was
Um,
like Lila got something. Yeah.
Yeah, just a quick question, because I know Crawford is on this call and, you know, some of the passion and impetus and thought came from him. And so, you know, when we look at the expected outcome, develop a holistic mental health strategy as part of CAB's policy and budget recommendations. Crawford, did you have something specific in mind, or it's really up to this subcommittee to identify that?
Well, I'm tickled to death, first of all, just to see that items, 3, 4, and 5 under goal 2 are now included in the plan. And at least, you know, for me, it shows that we're serious, we're focused, and we've identified 3 areas there. So from that vantage point, as I said, I'm pleased. And I just think it's great, and particularly listening to Dr. Cole, to Patrice, and to you, Lila, and to Ozzy, to see the way everybody is coming together on this. Hey, I'm loving it. Hey, I just want to sit back like the fly on the wall, so I'm fine.
Thank you so much, because I feel like I remember at one point you were talking about every agency or department having some type of mental health offering, and I didn't see that necessarily listed here, so I was just curious. So thank you so much.
Yeah, I was there, but as they say, you just need to listen and see what develops. And I think we're on the right path, and maybe down the road, that's something we need to take a look at. Is it feasible? Maybe, maybe not, but hey, I think we're on the right path.
Thank you, Crawford. I'm turning it back over to you, Ozzy. Thank you for letting me jump in with that question, that last question.
Hi, Lila. I just wanted to say we have about 4 minutes left, and Ozzy is here, but she's in the middle of something. So I'm wondering if you can wrap up the meeting, Lila, if that's okay.
Sure, no problem.
And so the next item, I don't think Ozzy has an update yet, because she said the meeting has not happened yet. So probably for the record, you can just mention that she will provide an update later.
Okay, sounds good. And so we have completed speaking about the third area of the goal 2. Can we scroll back up, Monique, to the agenda?
Patrice's, she's scrolling up now to the very
Oh,
beginning.
sorry about that.
No worries.
Thank you, Patrice. All right. Great. So I'll make a note that it sounded like I'm sorry, that can you just reiterate that, do we have any RJOB or AOD meetings that we need to update on?
No, not at this time. Ozzy will provide an update later, but I don't think the meetings have occurred yet.
Got it. Okay, thank you.
And just the update too on RJOB, they, the committees, a good chunk of them, I think, took off kind of this month. So our diversion committee and data and services committee, data subcommittee has canceled their meeting for this month. And what was the other one? Oh, community engagement funds. I believe they had theirs. I'm not sure.
Got it. Okay. So it looks like we have about 1 minute to see what kind of next steps we have captured. Anybody who has captured any next steps, please call them out. I will be putting together the brief notes. I take very detailed notes, and so I think it sounds like there is some interest to learn more about, more in depth about the different mental health services that are being offered. And so, as we identify presentations for that, that can be a next step. Anybody else have anything that is coming up for us as a next step? I believe we also wanted, I saw some interest, Patrice, in reviewing the financial information for the different wellness organizations. So if we could do that at the next meeting, that would be very helpful. Anybody else have any next steps?
Yeah, Lila, I'll just add before you adjourn. We wanted to make sure that the recommendations kind of get a sound recommendation for what's been going on prior, what recommendations hadn't made any movement, and how do we make movement with that recommendation that is current, and then look at the very challenging ones and what's being improved so that we can make sure that we're not adding on to recommendations that we may need to be working on before we add new recommendations. So that's something we need to probably review moving forward for next steps.
So to Dr. Cole's point, what we could add to the next agenda is the policy brief that you all just briefly looked at, and then also the year before that, the recommendations and the staff responses to them. Some of those, there were things done, and then there were others that are still outstanding, and then in addition to the ones you recommended last year. So we got both of those documents for your review the next meeting.
Perfect. Sounds like we have our next steps identified, and we will meet again on July 15th, 10:30 a.m. Thank you, everybody, and have a great rest of your day.
Thank you. Enjoy your weekend.
You too. Bye-bye.